Mr. Dylan McKay is a 24-year-old male with insignificant health history who presents with right-sided abdominal pain of 8-hour duration. Mr. McKay was feeling well up until one day ago. He is a very fit, physically active university student who works part-time at the local restaurant. Symptoms began one day ago with generalized abdominal cramping. 8 hours ago, the pain migrated to the right lower quadrant, with an increase in the intensity of the cramping. He rates the pain 6 out of 10, with an increase of 8 to 8 out of 10 on movement and coughing. Minimal movement and helping has helped relieve the pain. Since onset of symptoms, one day ago, Mr. McKay has been unable to eat, and 8 hours ago, prior to visit, Mr. McKay has become nauseated and has had 2 episodes of vomiting with exacerbation of pains that were caused by coughing and physical activity. No treatments have been tried at this point, and this is the first time that he has had such symptoms. Mr. McKay has no significant family history of disease that he is aware of. He does not take any medication. Tonsils were removed at the age of 2. He is a social user of marijuana. He states he drinks 6 to 8 beers per weekend. He's got no family history of any abdominal disease. Medical profile includes an allergy to sulfa drug, no prescription medication or over-the-counter medication, and he is an occasional user of marijuana. Aside from the past tonsillectomy, there is no other past medical history. Mr. McKay comes from a middle-class family. He's currently attending university and has a grade B average. He lives with his parents. And Mr. McKay describes life as being very good. Upon physical examination, Mr. McKay is pale. He's sitting in the chair and guarding the right lower quadrant. Mucous membranes are dry, and he appears ill-looking. Vital signs are the following: temperature 38.2 degrees Celsius, pulse 102 and regular, respirations 19 and regular, blood pressure 127/81 to the right arm, oxygen saturation are 98% on room air. Visual inspection of the abdomen shows a flat abdomen with peristalsis and aortic pulsations noted. Auscultation of the abdomen in all 4 quadrants shows hypoactive bowel sounds. Patient states passing flatus and has not had a bowel movement in 2 days. Percussion reveals dullness over the liver and tympany over the stomach and the intestines. Percussion was not done over the right lower quadrant because the patient is in a fair amount of pain and guarding the area. Light palpation of the upper and right quadrants reveals pain and tenderness on palpation. Light palpation to the left quadrant does not reveal any pain. Deep palpation to the right upper and lower quadrant reveals a fair amount of pain and facial grimacing. And deep palpation to the left quadrant does not reveal pain, but does reveal some tenderness. Special testing of the Rosving, psoas sign, and obturator sign are all positive, and the McBurney point tenderness test is also positive. In summary, Dylan McKay, a 24-year-old man with 1 day of generalized abdominal pain, and 8 hours prior to visit, this pain migrated to the right lower quadrant. He describes the pain as a cramping sensation, 6 out of 10, and increases to an 8 out of 10 on movement and coughing. Resting helps alleviate the pain. Since the onset of the cramping, he has not been able to eat, and 8 hours prior to the visit, he has been nauseated with 2 episodes of vomiting on exacerbation of the pain. No treatments have been attempted at this point. He has no significant health history, social history, or family history of disease. He has an allergy to sulfa drugs. He does not take any prescribed or over-the-counter medication. Physical assessment reveals a pale-looking individual guarding the right lower quadrant. Vital signs are stable except temperature at 38.2. Abdomen is flat. Bowel signs are present and hypoactive. He's showing tenderness to the right upper and lower quadrant. Rosving, psoas, and obturator sign are positive. McBurney point tenderness sign is also positive. These are indicative of appendicitis.